So in today's video, I want to talk you through how you can hopefully solve anterior hip pain or pain at the front of the hip. Now this shouldn't be confused with groin pain, which is obviously more centrally, or more of the lateral hip pain like a hip bursitis or something like that. We're talking about pain that often resides just on the inside of that bony bit at the front of your hip. The main thing is it doesn't tend to go away for people unless you target some specific areas. So in terms of where we're going to focus, we're obviously going to focus on the front of that hip clearly to try and find some of those symptomatic areas that you might be feeling. But interestingly, we're also going to go looking around the back of the hip for any signs of restriction that might be perpetuating the discomfort through the front. But lastly, we're also going to touch on the lower back. So as always, the first thing that we need to do is make sure that we get a baseline measurement so that you can understand exactly how your symptoms feel to begin with, that we can revisit at the end of each one of these exercises to see what impact, if any, they've made on your symptoms. So for a lot of the people that have this issue that I see clinically, sitting cross-legged is something that can generally target that dysfunction at the front of the hip. Whatever movement or activity that you feel gives you those symptoms, do that first and then come back to it periodically after each exercise to gauge the progress that you've hopefully made. So the first exercise that we want to go through is one that you can do to go looking for any hidden dysfunction in your lower back that might be contributing to the pain and the dysfunction at the front of your hip. Now the connection here is that your hip flexor area attaches to the front of your lower back. So if you're having some dysfunction, where there's some bursitis or some tightness or some clicking or some catching at the front, a great place to start here is looking through the lower back to see if there's a handbrake basically at the top. You can be pulling slack out of the front of that hip and contributing to the dysfunction that you feel. So again, if you've been a follower of the channel, you know how effective using a ball can be at hunting for that specifically hidden dysfunction. So again, what we want to get you to do is take that ball, and the areas of your back that we're looking for is essentially from the lower half of your back down to the base of your rib cage, down to sort of the lower reaches of your back, and place the ball in the middle of the back, let it roll out to the side a little bit. And as always, we want to get you to lie down onto the ball, gently letting it press into areas that might feel tight, stiff or tender. Again, once you've found one, all we want to basically get you to do is just let the ball respectfully press in there for as long as it takes for you to feel less stiff, less tight, less tender. Now obviously we're looking to do it on the same side as the side that you're having your hip dysfunction, but just pay attention to both sides because sometimes the handbrake can be on the opposite side to what you would expect. So again, once you've found a spot, I want you to stay here for 30 seconds, a minute. Once you've had enough of that spot, we want to get you to move the ball up a little bit or down a little bit. You come out to the side a little bit more, go looking for that specific dysfunction that you didn't realize or you may not have realized was there. Give it a chance to settle, and then once you've done that for a few minutes, recheck the exact same movement and position or shape that you had previously for clues as to whether you feel less tight, less restricted, or less sore through the front of that hip. And based on what I found clinically, it may not be the thing that instantly cures you of your anterior hip pain, but you should feel like there's some immediate change after doing this exercise. And so the second strategy that we can use again references the ball, and it again hits a spot that isn't the front of your hip. You can take the ball and press it into the back of your hip through your glute area. Traditionally, the tightest area is the back pocket area where that piriformis tends to be. But again, it doesn't matter where you are or what the name of that muscle is. We're just going to go hunting for things that feel meaningful to you. So again, we want to move the ball around, looking for something that feels a little bit tight, a little bit tender, a little bit restricted. Once you've found that, we have a few different options. The first thing you can do if it feels quite tender is you can just gently relax and let the ball press in. You can prioritize your breathing and focus on your breathing to help your body cope with this. And basically what that looks like is if you just take a deep breath in and then you sigh on the way out. And what this does is that this cues your brain into down-regulating and decreasing that pain signaling in the area. So you might find that not only does it become less tender, but it may also prompt your musculature to relax and release a little bit faster. Now, if you want to speed this process up a little bit more, another strategy that you can use is that if you tense the muscle that the ball is in, give it a squeeze for about 5 seconds. What this does is get your brain involved so that when you stop tensing it, your brain will relax and release that muscle further. You should feel like the ball will sink in a fraction further than it did previously. And those strategies can be a great way to instantly release some of that hidden muscular tightness around the back, to feed some slack into the front of the hip, and make positions like sitting cross-legged feel more comfortable and unload the areas that have become irritated and uncomfortable for you. And now the third exercise that I want to touch on is one that absolutely targets the front of that hip, looking for the symptoms that you feel. Obviously, we can't neglect exactly where you feel your symptoms, but I just wanted to provide some previous context behind why those symptoms might be there in the first place. And clinically, we obviously need to pair up some strategies that make you feel that you have control over decreasing the pain at the front of your hip, while also making sure we're getting the potential underlying cause of that anterior hip pain at the same time. So what we want to do this time is we want to take that same ball and place the ball through the front of the hip to help you go hunting for where your specific symptoms might be. So how that looks is we want to basically target just inside from that hip bone, place the ball in that area, and then just lie down gently on top of that area. So not specifically on top of the hip bone at the top, but just inside from that. And we want to basically come up and down from that area, looking for things that feel specifically like your restrictions. And then again, like we did through the back, once you've found something, so for me, I found a really nice tight spot here, we can just gently relax, let the ball press in. We can take some deep breaths with a sigh to help lubricate that process, allow that tissue to give a little bit faster. But again, if you're impatient, we can squeeze that muscle, try and tense your hip flexor up, squeeze your butt cheek, squeeze everything at the same time. Hold that for 5 to 10 seconds so that when you relax that, your brain relaxes the muscle and it doesn't feel as tight and restricted as before. Now, with this particular area as well, what you can also do is once you've found a really nice spot, you can gently bend your knee and try and lift your knee off the ground. This may feel quite tender for some people, but what we're looking for is to basically lift your knee up off the ground to try and shear that hip flexor or that tissue at the front of the hip through underneath the ball, ultimately encouraging more movement through the front of that hip. And then again, once you've done that and hunted around for all the things that you feel are important, we can come back to that exact same position again. And you should feel, whatever the shape is for you or the position that exacerbates your symptoms, it should feel instantly looser and a little bit better than what it was before. So as always, I genuinely hope that was helpful. I hope it gives you some food for thought to add in amongst some of the other exercises you might already be doing for your anterior hip pain. Please consider leaving a like and subscribe to the channel. Please consider leaving a super thanks if you want to help support me and the channel going forwards. But as I said, thank you for watching. I hope that was helpful and I'll see you next time.